Hello guys, welcome to my YouTube channel Ayurveda Asking. So today video is very special and it is for the Swastha paper 2. And nowadays, as you know, BMS second prof exam are going on and there are so many subjects. And in Swastha paper generally we think it's very easy, but in paper 2 actually big syllabus is given and all the points are not Ayurvedic, they all are modern point. There are so many definitions and one of the important and big portion is this program portion. There are so many programs are given in that second paper, and out of this program 110 marks question will be there, okay, and MCQ. So we have to cover this program, and actually sometimes we don't know which program will come for the exam. So for that we have to do all the program, and all the program is such a big burden. So this video is going to be very short, in which we are going to see what are the key essential points we should know about the program that is launched by our India National Health Programs. And in that some are like important program I have already marked, and the important point from that I also marked, and these are the minimum basic. For example, if you didn't study, you should write at least this point. If you studied well, then it's very good, you can write all the point. But let's say you didn't study and you don't have that much time to give all the time to the program only, you have to study other portion also. So that's why this video is going to go for those students, and this program are really very important, and actually they are important from the competitive point of view. But in this video we are going to discuss the very important, the syllabus point that is mentioned that we should have to know about the program. Okay, let's start our video. So first program is given is National Leprosy Eradication Program, and it's also known as NLEP. Actually it's a very big program, but here I have written only the concise and only the important point. Okay, so launching year is 1955. When it launched in 1955, it's known as National Leprosy Control Program, NLCP. But after that, when multi-drug therapy come in 1982, so it is renamed as National Leprosy Eradication Program in 1983 with the use of multi-drug therapy. Okay, second point is what is the vision or the objective of this program. So vision or objective of this program is eliminate the leprosy as a public health problem and prevent the disability and stigma. Basically, as you know, leprosy is a bacterial infection, Mycobacterium leprae, and it is one of the there are so much social stigma is also there, and disabilities happen here. So we have to prevent this stability and remove that stigma. And sometimes leprosy is also taken as the base for the divorce also. So all those kind of things we have to eliminate this leprosy from the public health problem. Then what is the goal? Our goal is maintain a prevalence 1 per 10,000 population, and early detection and treatment, and reduce the grade 2 disability cases. Then what is the strategy we are going to do in this program? First is active and passive early case detection. Active and passive means first case is like a patient is himself reporting to the hospital. Second case, when ASHA worker or health professionals going to home and taking the case survey. So both the type are case detection, active as well passive were taken. And second is multi-drug therapy is used, disability prevention and medical rehabilitations. For all the rehabilitation are taken, like medical, physical, social, vocational. So all those medical rehabilitation are taken. And IEC, IEC is one of the keywords and you can use in every program. This is one of the tricky, because every program we have to give information to population, we have to educate them, we have to communicate them. So IEC is one of the common point you can write in every program. Then what is the plan of action of our program? So plan of action is contact surveys and special campaign. there are so many surveys that happen for this, and so many campaigns for the leprosy, the control and the treatment. For free multi-drug therapy is given through the public primary health care, reconstructive surgery and self-training, because as you know there is happening the disability, so we have to remove or reduce the disability, so that's why we are doing the reconstructive surgery and self-care training. Then integration with the general health care. General health care means PHC and all, and ASHA involvement, so that we can give it to the grassroots level also. Then what is the important point? Through this whole program we have India eliminated leprosy in 2005. This is one of the important, it can come in MCQ also. Focus on the stigma reduction and the disability prevention. Second important program is the National AIDS Control Program, also known as NACP. It's launched in 1992, and its vision or objective is prevent the HIV transmission and ensure care, support and treatment for the affected person, because as we know it's one of the viral disease and happening due to the HIV virus. So we have to prevent, first we have to prevent the transmission, so because there is no treat for all this now. So first we have to prevent the transmission, then we have to give care, support and treatment to the affected one. Then what will be the our goals? So our goal is reduce the HIV infection, reduce the AIDS related death, eliminated the stigma and the discrimination. Then what are the strategies we are going for this program? First strategy is targeted intervention for high risk group. So there are two type of group that is coming here. One is the high risk and one is the vulnerable group. So high risk group are the sex workers are there who have a multiple sex partner, and the drug abuser who are taking drug intravenously. Then vulnerable group is the truck drivers and all. So this group we have to target and we have to do the intervention. Second is the blood safety, because HIV can transmit from body fluids now. So blood safety is one of the important aspect and we have to do it very properly. Then PPTCT means prevention of parents to child transmission. If it is transmitting from parent to child, we have to stop that transmission. And free ART means the antiretroviral therapy, because it is a virus, so we have to give antiretroviral. Then what is the plan of action? Plan of action, there are majorly 4 points. First point is ICTCs and IRT center, means integrating counseling and testing center, and antiretroviral therapies is given. Then second is for prevention of the for this transmission, prevent free condom promotions is there. Awareness and behavioral changes campaign are launched. Surveillance and the research updates on the AIDS and how to control it, all this happen as a plan of action. Then what is the important point? So it is implemented in the phases, NACP phase 1 to phase 4, and here I have written all those phases. For example, phase 1 started in 1992 to 1999, and mainly in that awareness is given, and our main target is slow the transmission rate. Second, the phase is 1999 to 2006, in which several intervention, behavioral intervention, all are given. And phase 3 is 2007 to 2012, in which service and care is the main focus. And in fourth phase 2012 to 2017, mainly stigma prevention, IEC promotion, all those coming. And it is managed by one of organization, that is NACO, National AIDS Control Organization. Next comes the third program, National Program for Control of Blindness. And these two programs are very important, so it can come in your exam, National Leprosy Eradication Program and NACP. Next and a third program is National Program for Control of Blindness, NPCB. And blindness is like one of the important things that is happening to the peoples, and that's why government launched this national program for control of blindness. If we can prevent it, we have to prevent it, and it is launched in 1976, and our vision is to avoid the prevalence of avoidable blindness. Prevalence means new as well as old cases. We have to reduce both of this by avoidable blindness changes. Then what is our goal? Our goal is to reduce the blindness prevalence to 0.3%. Actually there is one like that, from 1.4 to we have to reduce 0.3 by the 2020, and control cataract and refractive errors. For that we can do the surgery, and in early stages we have to detect in school children the refractive error, squints error, and we have to give free spectacle for BPL families who can't afford treatment and that all. Next is strategy. What the strategy we are going to do this? We strategy are like cataract surgery to prevent this cataract and all. School eye screening, because you know school health problem, one of the problem is the disease of the eye, ear, skin. So early screening can give us an idea, and we can give we can give the preventive care to those children. And next, the strengthening the eye care infrastructure, like ophthalmologist centers are developed, and various centers are developed so that people can get easy care for their eyes. Next is the plan of action. So plan of action, I have already said, like free cataract operations are given, distributions of spectacles, eye bank and donation promotion, training of ophthalmic manpower. Then what is the important point? Cataract is the leading cause of blindness in India. So if we prevent it, or if we give the proper operation for this, then we can prevent this blindness in India. And one of the important initiative is the Right to Sight initiative by 2020. Next program is polio eradication program. Okay, so polio eradication program actually very short, maybe don't come for 10 marks question, but you can write in many points. For example, if polio disease came, then you can write this program, and if immunization schedule come in also, because in that only one big table is there, you can study the table from the book, and after that if you have the time or space, you can write all the mentions disease program in that universal schedule of immunization. So it's launched in 1995, and its vision is to eradicate the poliomyelitis and maintain the polio free status. Okay, and you know polio is also one of the viral disease, and it is causing the acute, like one of the major complication is acute flaccid paralysis. So we have to prevent all those things, and our goal is interrupt the transmission of polio virus, because first every disease is transmitting, so we have to prevent that transmission, then maintain the high immunity to individuals. What is our strategy? So pulse polio immunization is there, where massive polio immunization is given. And you know nowadays also, like it's given when a baby or a children is given the polio OPV vaccine, so like X mark is given on their finger, so that we can know this person is immunized. Like that, this pulse polio examination is given, and those houses which do not have this X mark for the children, they again health professionals go to their home, and they give them immunization at their home, and after that they mark them present. So this is one of the pulse polio immunization that is coming under this program. Second is the AFP surveillance. AFP means acute flaccid paralysis that is happening in the polio. We have to give a continued scrutiny for this AFP surveillance. Plan of action is national and sub-national immunization days are decided, in which OPV is given, house to house vaccination is given, and here basically OPV, oral polio vaccine, is used, in where 2 drops are given orally. AFP cases investigation. Then important point is India declared polio free in 2014. Next program is National Tuberculosis Elimination Program, and is known as NTEP, and it's also important. It can come for 10 marks because it has so much content itself, and it's launched in actually 1962. It is a National Tuberculosis Program, but it is named as National Tuberculosis Elimination Program in 2020, and its vision is to eliminate the TB in the India by 2025. Goal is reduce the TB incident and mortality. Incidence means the new cases, mortality means the death is happening due to TB. Universal access to the TB care. Then what is the strategy we are going to use? First strategy is early diagnosis, free treatment including drug resistance TB, because it's one of the bacterial transmission that is happening due to the Mycobacterium tuberculosis. So we have to give a free treatment for those, and these are the special bacteria. We can't treat them with the simple antibiotic. So 5 main drugs, rifampicin, ethamide, all are given, and along with that drug resistance TB is also addressed. Patient supports is given. What is the plan of action? Dose is given, directly observed treatment, short courses, daily regimens practice is given, and one of the important things is Niksha portal and Niksha portion Yojana. So Niksha is basically for the nutritional support, and where government is giving the money for their portion of the TB patient, and private sector management engagement is there. Then what is the important point? TB is one of the notificationable disease. Okay, and one of thing is there like Nikust. Nikust is one of the portal that is happening for Kushta means leprosy. Nishcha is for this TB. Next program is a National Vector-Borne Disease Control Program. It is also important, but it's a very big, there are 6 main diseases coming in this, so we have to write 6 individually, and there are separate program for going on there, but in this single program all are included. So it is one of the big program, but they can ask, and along with that they can ask one program out of this. So it is launched in now 2003, and our vision is prevent and control the vector-borne diseases, and there are mainly 6 diseases: malaria, dengue, chikungunya, Japanese encephalitis, kala jar, filariasis. Okay, and out of the 6 diseases, 5 are the vector mosquito, and the kala jar having the sandfly as a vector. Our vision is to prevent this. Then what the strategy we are going to? Strategy is integrated vector management, early diagnosis and treatment, surveillance, and the outbreak responses. Then what is going to our plan of action? Our plan of action is indoor residual spraying. Spray is given for that because these mosquitoes, or generally we are always using spray and all now, and use of LLINs means long lasting insecticidal nets, larva source management, because larva is one of the important stage for mosquito. If we manage that, then we can prevent this mosquito bleeding and all those. Then rapid response team. Important point is now submerged under the National Center for the Vector-Borne Disease Control 2021. Next program is the Reproductive and Child Health Care Program. Okay, this is also one of the important program. It's also very small program. Maybe it's not come for 10 marks, but MCQ can ask because important program. So it is also launched in 2 phases. First is the 1997 RCH1, and second in the RCH2 in 2005. Okay, then what is the vision of this program is improve the reproductive, maternal, and newborn child adolescent health. So we are including the reproductive women's, then maternal, newborns, child, and adolescent health. Then what is the goal? Our goal is to reduce the MMR, that is maternal mortality rate, IMR, that is the infant mortality rate, and TFR, universal access to the reproductive health services, because reproduction, even health service are the principal right for every person, so we have to access to them for all the individuals. Strategy is the skilled birth attendance, because so that's why institutional deliveries are promoting Through that we can give the proper sterilization, proper care to that female as well as to the newborn. Then family planning is given. Okay, child survival intervention. Then mode of plan of action is antenatal and postnatal care is given. Institutional deliveries are promoted. GSY and GSSK means Janani Suraksha Yojana. It can come from MCQ. Okay, Janani Suraksha Yojana, that is 2005, and Janani Shishu Suraksha Karyakram for 2011. Then adolescent health programs are given. Important points is form norm of the NHM, that is National Health Mission. Next program is the Integrated Child Development Service, ICDS, important program. Okay, launched in 1975, 2nd October. Vision is improve the nutritional and health status of children 0 to 6 year and the mothers. And our goal is reduce the malnutrition, anemia and mortality, because in the children and some like socio-economic low cases, they have malnutrition, one of the major thing. Anemia is there, and due to this nutritional thing, mortality is happening. So we have to reduce all those things and promote the early childhood development. So what are the strategy we are going to use? Supplementary nutrition is given to treat this malnutrition and anemia. Health checkups are there. Nutritional education is there, and plan of action is one of the important things. Is Anganwadi centers are there. As you know, in every places nowadays Anganwadi centers are there, that is coming under the ICDS. Growth monitoring is there. Preschool education, because 0 to 6 year children is going Anganwadi, so in that he is not going to school, but he or she should be given some kind of education that is known as preschool education, that is given in Anganwadi centers and all, and it is the referral service. Next is the important point is that it is one of the world's largest child nutrition program. Ninth program is the Universal Immunization Program, that is launched in 1985. Okay, and its vision is protect the children and pregnant women from vaccine preventable disease, because if a disease is prevented by the vaccine, then we should have to prevent it. And through this like schedule is given in the book and the table. I will upload the table in the Telegram, or photos in the videos description, you can watch from there. And this PPT I will upload in that in the our description of the video. You can see from that point, because these are the minimum and basic point that is I am giving for the program. And in my paper I also study from this. If it comfort, if you like, for example, if you study in a leprosy program and very nicely you study, but it didn't come for 10 marks, and if you see all the program out of this, if anyone come, you can write something. Okay, next is the strategy. Strategy is the fixed and outreach immunization. Then cold chain management, because vaccine we have to prevent by cold now, so cold chain management. Then plan of action is the national immunization schedule is launched. Missing mission Indradhanush is coming, and you have to comment me what are the diseases we are addressing, or what are the vaccines we are giving for this mission Indradhanush. Monitoring through HMIS. Important point is that cover the disease like TB, polio, measles, diphtheria, hepatitis B, then DPT, polio, measles, TB, rubella, hips, rotavirus, JE, pneumococcal pneumonia. Then milestone is India become polio free in 2014, eliminate and maternal and neonatal tetanus in 2016, because this neonatal tetanus is like one of the major concern. Next program is National Mental Health Program. It is launched in 1982. Its vision is ensure accessible and affordable mental health care, because mental health is also important along with physical health, and our goal is reduce the mental illness burden and promote the community mental health. Then what is the strategy we are going to use? integration with the primary healthcare, so we can give it to all the health level. Capacity building. And what is the plan of action? District mental health program launch, training of health worker is given, community awareness. Important point is that DMHP is the backbone of the NHMR because it is a district mental health program. Okay. Next is the NPCDCS. In my exam they give 10 marks question from this portion, and I think nobody has studied this program. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stone. It is launched in 2010, and our vision is to prevent and control the major non-communicable diseases. So what is our goal? We have to early detect them and reduce the premature NCD mortality. Strategy is lifestyle modification is there in the form of food habits, in the form of daily regimens, and screening or early detection is there. For example, high BP, cholesterol level, all these parameters are screened regularly. Then health system strengthening. Plan of action is population based screening is there, NCDs clinic develop, referral and follow up. Important point is mainly focus on the more than 30-year age people because they are more prone for this. Next comes the Swachh Bharat mission. Swachh Bharat mission is launched on our Gandhi Jayanti 2nd October 2014, and our vision is to clean and open defecate free India. It is also launched in 2 phases like of RCH 2014 to 19 and 2020 to 25. So our goal is eliminate the open defecation, okay, because that is one of the major problem previously, and improve the sanitation and hygiene. So what is the strategy for preventing this open defecation? Toilets constructions are there, behavioral change communication given, plan of action is household and community toilets developed, solid and liquid waste management is given, monitoring the ODF status. ODF status means open defecation free. Then important point is that it is divided into Swachh Bharat Mission Gramin, Swachh Bharat Mission Urban. Okay. Next come the Ayushman Bharat Yojana, and this is one of the financially important yojana that is launched in 2018, and its vision objective is achieve universal health coverage by providing accessible, affordable and quality health care. Then what will the goal? Goal is reduce the out-pocket expenditure. Means sometime in health services or in hospitals, basically in secondary or tertiary care, we have to expend that much that we don't have. So that reducing that things in this program is launched, strengthening the primary and secondary healthcare and provide financially protection to poor and vulnerable family for secondary or tertiary care. These 2 components are there, and this is important things. Generally famous component is this Pradhan Mantri Jan Arogya Yojana, but one other strategy is there, health and wellness center. Actually this PHC, CHC are converted to health and wellness centers. Then plan of action is upgraded sub-centers PHC into the HWC and provide cashless hospitalization up to 5 lakh per family per year. That is one of the important point. And impanel the public and private hospital. Important point is it is world largest health insurance scheme and cover 10.74 approximate 10.7 crore poor families. Next is Ayushman Bharat Digital Mission, launched in 27 September 2021. Recently launched. Vision is create an integrative digital health ecosystem, and its goal is ensure interoperability of digital health services. So monitoring, notification, all those coming in here. Empower the citizen with digital health record, and strategies digital platform and unique health IDs are given to each individual. Secure data sharing. Plan of action is ABHA. ABHA is one of the important things. So it can come in MCQ because it is a very small program. So maybe it will not come for 10 marks. But MCQ can come. ABHA is the Ayushman Bharat Health Accountant. Digital health records are made and they have secured also. Because this they have to prevent from hacking and all. Health professionals and fields facility registry. Important point is that it voluntarily and consent based. Okay, because without consent you can't public anything of a patient. That should be a very much you have to maintain that privacy, ensure the data privacy. Next program is National Health Mission, and it's having two components: National Rural Health Mission and National Urban Health Mission. Okay, launching year is National Health Mission launched in 2013, but this rural is launched before that in 2005, and National Urban come with this National Health Mission. And our vision is to provide accessible, affordable, quality healthcare to rural and urban. Basically, urban population can get maximum time benefit, but rural is always beyond or back. So we have to strengthen and we have to access, afford the health quality care to that rural population. Then goals is to reduce MMR, IMR, TFR and strengthening the public health care system. So strategy is the decentralized plannings, community participation, public-private partnership. Plan of action is that strengthening PHC, CHC, district hospital, ASHA workers. Okay, one of the important things. And a free drug diagnostic and transport things. Important point is that backbone of India's public health delivery system, then focus on the RMNCH plus A services. Next comes the National AYUSH Mission NAM, and it's launched in 2014. Okay, these two program launched in 2014. This and Swachh Bharat mission promote the AYUSH system of medicine and integrate them with the mainstream. So it basically mainstream our AYUSH, and that is very a big opportunity for all Ayurvedic, yoga, naturopathy, Unani, Siddha and homeopathy practitioner. Goal is improve the availability and quality of AYUSH service and promote the preventive and promotive healthcare. Strategy is co-locate of AYUSH facilities and capacity of building and education. Plan of action is strengthening the AYUSH hospital and dispensaries, supply AYUSH drug IEC service, that is information, education and communication. Important point is cover Ayurveda, yoga, Unani, Siddha and homeopathy. National nutritional program is, and there are some program launched under this heading, National Iodine Deficiency Disorder Control Program, because iodine is one of the major concern that is related with the goiter. Okay, so for this National Iodine Deficiency Disorder Control Program launching year is 1992. Earlier it is National Iodine Program, that is 1962, and here a National Goiter Control Program coming. Okay, but this program National Iodine Deficiency Disorder Control Program coming 1992. So its objective is to eliminate iodine deficiency disorder, and goal is universal consumption of iodinized salt, because iodinized salt is one of the key factor for this goiter or iodine deficiency. Reduce the IDD prevalence. Strategy is salt iodinization, monitoring the iodine level so that we can give, oh, that much iodine is less, so we have to give that much. Plan of action is surveillance of IDD cases. Okay, quality control of iodized salt IEC activities. Important point is ban on the non-iodine salt for human consumption. Next program coming under the heading is National Iron Pulse Initiative for anemia control, because anemia is also one of the very prevalent disease, and it is basically the iron deficiency anemia. So it is launched in 2011, and our vision is reduce the prevalence of anemia across life stages, anemia Mukt Bharat. And our goal is prevent and treat the national anemia. Strategy is life cycle approaches, and iron folic acid supplementation is given especially to pregnant lady, adolescent lady, both male and female, and who are very prone to this anemia. Then plan of action is weekly IFA tablet is given, iron, folic acid. Biannual deworming is given. Deworming means that melbendazole is given. Nutritional education. Okay. Then important point is cover for children, adolescent, pregnant and lactating women. Next program coming under heading is National Vitamin A Prophylaxis Program. Again, blindness is one of the important prevalent disease, and the launching year is 1970, and vision is prevent the vitamin A deficiency and nutritional blindness. So our goal is reduce the morbidity and mortality in children. Strategy is periodic vitamin A supplementation is given to reduce this thing. Plan of action is oral vitamin A dose at scheduled interval, and integration with the immunization, and massive dose is given actually. Targeted point is target children 9 months to 5 years. So when children is 9 months, then one international unit is given, and when second dose is given on 16 month, and after that up to 5 years 6 month interval 2 IU is given for children. Okay. Next come the midday meal program. Midday meal program is actually one of the program that our government launched for encouraging the literacy rate, because actually what they think, when you give free food to schools, then children will come for the eating the food. So that's why improvement of attendance is there, literacy rate will be improved, and launch in 1995 improve, and also we with that we can improve the nutritional status of school going children. Goal is reduce the classroom hunger, improve the school attendance and retention. Strategy is provision of cooked meal in the school. Plan of action is hot cooked meal is given, monitoring the nutritional quality, community involvement, now called PM Poshan or PM Poshan Shakti Nirman. Important point is cover the children in government and aided school, and the last program coming in program series is Balwadi Nutrition Program, launched in 1970. Its vision is improve the nutritional status of preschool children. Means like for school going children we are giving the midday meal, but for that preschool what we have to give, so that's why Balwadi nutrition program is there. Prevent the malnutrition in the children age 3 to 6 years. Strategy is supplementary in nutrition. Plan of action is nutritional milk or snacks at Balwadis, and growth monitoring. Important point is pre-ICDS nutrition program, and now it is integrated with ICDS. So here we have completed all the program, and again I am saying to this, so these are the minimum basic. Okay, like if you didn't study, you must have to study up to this. If you study all the program very nicely, that is a very good thing. Okay, but in case they are so big and they are taking so much time, and who are starting now or revising, they can't get that much time to revise them at instant. So you can revise from the series, and if you write this minimum point, you have to enlarge them. For example, when you write goal or strategy, you just explain then, oh, what is happening in this. So that's why like this you can at least fill 2 or 3 pages in your examination. And for example, you study the TB program, you study the leprosy program, important you study, but sometime what happened, this Balwadi came or the Swachh Bharat mission came, so that you have to know the launching here at least, vision, goal, strategy, and these are the headings that is mentioned in our syllabus. So here we will end our video session. Okay, thank you guys.